have our Pennsylvania State Dairy Princess, Selena Horse. So good morning, Selena. How are you doing today?
I am good. Good morning, Brittany. As she said, I am Selena Hurst. I am your 2022 Pennsylvania Dairy Princess. So with us today, we are going to be joining you virtually. We are at the William Boucher Field Service at New Bolton Center, provides routine and emergency health care for equine and food animal clients. Field service specialists offer preventative health care representations, services, evaluation and treatment of lameness, medical and surgical disorders, on-farm diagnostic services, and emergency services. Emily, a UPenn food animal service specialist, is going to talk to you today how she helps the dairy cows here at the hospital barn at Marshak Dairy and about careers in the veterinary industry.
Hello, Emily. How are you? Thank you for joining us.
I'm doing well.
Today.
Yes, absolutely. Thank you so much for having us. We're really excited to have you all here virtually, in person, everything, so that way you guys can kind of see all the different aspects of dairying, and then also specifically for me, learn about being a veterinarian and specifically a dairy vet. So basically the kind of goals here, we're going to go through a little bit about what I do every day in terms of being a food animal veterinarian. My specific interest is dairy cattle, so very pertaining to this topic here. And then we'll also take you guys in so that you can see what we do during a physical exam on a cow whenever we get called for any sort of sick animal appointments or anything like that. I think our in-person people just arrived. So I can kind of carry on because I think Dr. Drake is going to run things with the in-person people, if you guys are okay with me just continuing. So for schooling, since this came up with the last group and my path to kind of becoming a veterinarian, I grew up in Harford County, Maryland, worked on some dairy farms there. My best friend had a dairy farm growing up, so pseudo I had a dairy farm and got kind of in touch with different dairies in the area, worked for them as a milker, farmhand, anything like that, as well as starting to shadow large animal veterinarians. Always knew that I wanted to go into food animal veterinary medicine, so I went to the University of Vermont. They have an excellent animal science program, dairy program specifically. Some of the students were asking any suggestions if you're interested in going into food animal veterinary medicine at all. I always say if you're interested in agriculture at all, go to a college that has a great agricultural program or anything in relation to animal science. Those schools typically are very specialized to try to set people up for future careers in that area. And that's a great option for anyone that is looking for that sort of a career in the future. And then for vet school, I came to the University of Pennsylvania. So I graduated from here, did all of my schooling here. I went to Ohio State University for my first year of practice, my internship year following graduation, came back to Penn for my residency here in field service, and now I'm a staff veterinarian here at Penn Vet. So that's kind of the trajectory. If you are interested in going into vet medicine at all, you'll need to go to college and then also to vet school and carry on from there. So in terms of a veterinarian's role on a dairy farm, obviously it's kind of very multifaceted. So first and foremost, my patient in general is the dairy as a whole. So that's kind of one of the special things about being a production animal vet. It's not just about individual animal care. There's a lot of aspects of my job where I'm looking at the entire herd as my patient. And so I'm putting together health protocols. I'm doing walkthroughs with owners, looking at facilities or any other kind of disease concerns or anything like that. The biggest thing in being a vet for production animals is I want to put together enough protocols that this dairy can function without me having to be here every day. So I need to train the employees. How do we identify sick animals? Usually on my farms, I've got a few people that I've worked with to train them on how to do a physical, so that way they can kind of start diagnosing problems and figuring out what diseases we're dealing with and start those treatments before I have to necessarily get involved. Obviously, I have many different farms I have to go to every day, so I can't just be in one place all the time. And so that kind of training aspect is a huge part about being a large animal veterinarian. And then on the other hand, we do individual animal care. So we'll be here almost every week on this dairy in particular, doing any sort of reproductive examinations on the animals, trying to figure out which cows are pregnant, which cows are not, helping them with any sort of fertility problems. But then we'll also have to get called here to look at sick animals in particular. So whether somebody has noticed that a cow is not eating as much, or usually our primary metric that will say, hey, this animal's a little off, not doing so well, is we can track their milk production in the parlor. So I always say, happy, healthy cows make milk. not happy, not healthy cows don't make milk. And so one of the biggest things is the computer tracks every single cow's milk production every day. And then the system can predict what they should produce the next day and the next day and the next day. And when she comes into the parlor, if she doesn't meet that predicted value, the computer is going to flag that to the farmer, say, hey, this cow might be having a little bit of an issue. And either the farmer themselves might take a peek at her, go ahead and do that physical exam I've trained them on, or that's when they might call us as the veterinary team out to try to examine them. So whether that's just doing a physical, figuring out some medical problem, and we just start some treatments and everything, or maybe it ends up being a surgical problem, and then I have to actually do surgery on that animal. One of the coolest things about my job that all of our students and anybody that ever shadows gets all excited about is we don't send the animals always into the hospital for surgery. It's very common that I do the surgery right here on the farm. So that's kind of special and a little bit different than any other type of animal in veterinary medicine. So if anybody doesn't have any questions yet, we can probably head into the pen here and start working with our cow a little bit. So I can show you guys kind of what we do for physical exams and such.
Yeah,
does that sound good?
Great. Yeah,
awesome,
no
great.
Yet, but we're excited to.
Perfect. Excellent. So we'll pop in here and we have all of our patients here. You guys will kind of see everybody else in the background divided up with all of our doctors and everything. So we'll work with this cow right here. So the biggest thing that I always tell people, usually you have to either get the animal into a restraint system like this, or she'll already be caught up. So we do an overall look at this animal and we say, does she seem bright? Does she seem dull and quiet? So she's got her ears up. She's kind of tracking everyone around her right now. Her eyes are nice and open. She's looking at Dr. Drake there saying, why are all these people around here? So we'd say she seems quite bright. She seems quite happy and alert and kind of attentive to her surroundings. So that's a good thing. Obviously, if she was quite dumpy, not really responding when we were moving around, that points to an animal that's a little sicker than what we would like them to be. So then the next steps would be that we'll come into the pen here. And I always tell everybody you have to be cautious. These are nice and large animals, but on the nice side, these are dairy cattle. And so they tend to be a little bit more handled, and she was perfect in our last group. So hopefully she'll continue to behave for us. So usually when we do physical exams on cows, we actually start at the back end here. I'm not sure if she'll respond to us in this step since she did it the last group and everything, but we can actually ask them to produce a urine sample as the first step of our physical exam. So we just rub on this section that's right between her vulva and her udder, and usually, there we go, we've got a urine production right there. So I can take that urine as a sample. I can go ahead and test it for different qualities relating to her kidneys. I can also kind of run some on-farm strips that will pop up depending on certain diseases like ketosis or anything like that. So just having that kind of quick little trick that we can do to get a urine sample from there. We would want to check their vulva. If you want to come this way, you can always get a picture of it to see that she's got very pink, moist mucous membranes. That's excellent. That's a great sign of good hydration. She's not anemic. It's not super pale. And we wonder, are we losing blood or anything like that? And then I would move on to taking a rectal temperature on her. So typically, just like dogs and cats, when you go to the vet for them, we do rectal temperatures on these guys. It's going to be your most accurate type of temperature. So that'll be a really good evidence for us whether or not this animal has any sort of a fever, or even if they have too low of a temperature. So either of those could be from an infection. So that's always very important that we want to assess that on her. And then we're going to move around. I'm just going to ask you guys to step up just a little bit so I can open this gate. Thank you so much. We'd move over to this side of the cow on the left here. And so basically our steps on these animals is going to be exactly the same as on a human or anybody else that ever goes to the doctor, right? What do they listen to? Heart, lungs, they start asking about your GI and everything. And so it's the same thing with these guys. So we would slide right in here with our stethoscopes to try to listen to her heart. We'd be listening to make sure that we don't have any sort of a murmur, and our beats are very regularly spaced. Everything sounds very normal there. There are many diseases that cattle can get in relation to their hearts. And so it's very important that we listen to that, but also just the rate that their heart rate is. So is it really high? And that could be indicating either pain or some sort of an electrolyte imbalance. And things like that. And so we always listen to the heart on both sides of the animal. We'll then follow up and listen to her lungs. I always say to people, it's a little surprising and confusing because I know her rib cage goes all the way back to here. These guys were not made to run marathons. They're not like horses. Their lungs actually don't extend that far back because they basically just eat all the time. Most of their body weight is GI. So all of their GI contents actually push up into their thoracic cavity up here. So actually her lung field is really only able to be listened to in this very small little area right here. And so I'd listen in a few different spots so that way I can once again assess her rate. So how many breaths is she taking per minute, but also I can listen to her different lung lung field, so the different portions of her lungs, to hear, do we have any crackles or wheezes, which would represent some sort of pneumonia or respiratory disease like that, or does it sound very clear and air is moving very easily? So it's really important to not only just listen for the rate, but also to check each of those different spots, because certain diseases will affect certain lung lobes in different locations. So by kind of differentiating that, I can tell what I can actually try to decide about what disease she's suffering from. And then, like I said, she's all GI. That's all she is. Ruminants are just massive fermentation vats. So people have probably heard that cows have 4 stomachs. Cows don't have 4 stomachs, but they have 4 compartments to their stomach. And so one of those is the rumen over on this side. And it's basically just this giant sack of feed that just has a ton of bacteria and other microbes turning it over, trying to digest all those little pieces of food. And so it's really important that we listen to that and we make sure that that is working properly. If the rumen starts not working very well, we start to have a big problem with these animals. So usually what we would do is we place our stethoscope right here, listen for a full minute, and we count how many contractions that rumen is having per minute, just to make sure she's digesting properly. We then listen to the side of her, trying to find what we would call a ping. And so it's a very high-pitched metallic tone. And so basically I would put my stethoscope on her, and then I would just flick all around it. And so if I'm moving this around and all I hear in my stethoscope, if it was in my ears, is a thudding noise, that's very normal. That's just my fingers. And you can see she's flicking a little bit. She's like, hey, get that fly off of me, but it doesn't hurt her or anything. But if I hear that ping, that's an indication that unfortunately she's twisted her stomach. She's got a lot of gas and fluid building up in there, and now I have to go and do surgery. So that's kind of that complete exam that we would do on this side. Then we would move over to the right side and we can go over there. We would do all of the same things. We just wouldn't listen to the rumen on this side because her rumen's not located on this side. Over here, we have other large intestines, small intestines, things like that. So I would still do my heart, my lungs. I could listen here just to hear all those other GIs, but it's not the same as listening to the rumen. And then again, I do my flicking over on this side. On this side, lots of things can ping. Different GI structures could ping very normally over here. And so it's not always surgery if I hear something crazy over here, but it still could be depending on the location on our abdomen that I hear that. After that, obviously, she's a dairy cow. So we have to take a peek at her udder. The biggest thing is obviously they can get mastitis, which is an infection of the udder. And so that can cause very abnormal milk. It can get very clotted, kind of looking like cottage cheese. The milk could change colors, anything like that. And so to start with, I would first just go ahead and I would feel all of her quarters. So remember, there's 4 quarters on this cow. And I'd want to make sure that they all feel very kind of soft and pliable. There's no major heat or anything like that. It's not red, indicating any sort of inflammation. So all that feels very good. Then I would go in and I would actually get a milk sample from each of her quarters and check to make sure that it does look just like the milk that you're getting from your grocery store. And then I would get a sample from each of those quarters. I can put a special chemical into it, swirl it around, and if the milk kind of turns into this jelly structure, it can indicate that there is potential mastitis there as well. So 3 different tests that we do to their udder, just to make sure that their udder is in really good health. Obviously, that's important for her health in general, but also it's important for her production level as an animal on this farm, right? Her whole job is making that milk. She's basically running a marathon every day by doing that, and we appreciate that effort by her. And so we want to make sure that her udder is super healthy. And then the final step in doing our physical exam is we need to do a rectal palpation. So you guys have probably seen before these large animal vets on TV. They get this big long sleeve, they bring it up on their arm, and then we lube up and go in rectally. And we can feel a bunch of different structures inside of them. So I would first assess her uterus. That can tell me if she's pregnant, if she's not pregnant. I can assess what stage of pregnancy she's at. I can also find any sort of a uterine infection. So the cow over to the side over here, she had just calved this morning. And so in the next few days, we want to make sure that she does not develop any sort of a uterine infection. And so if I got called here, tomorrow or the next day, part of my exam would be assessing to make sure that her uterus has gone back down to the normal size that it's supposed to be. It doesn't feel like there's any sort of gross discharge or anything. So it's very important that we pay attention to that. When I'm doing the rectal, I can always also reach forward and I can actually feel that rumen that we talked about. So that big sack of feed in there, and I can feel, does it feel like it's a little less full than it should be, or does it feel normal and everything feels very nice? I can even reach one of her kidneys in here, so I can give it just a nice little tap, make sure that she doesn't have any sort of a kidney infection or anything. And so there's just so many things that we can assess by doing that step. It's a very important medical procedure that we do on these animals to be able to assess that there's no kind of disease or anything wrong in any of of those different organs in the animal's body. And so basically just doing all of that big complete physical cues us into, are we dealing with a GI disease? Does this animal have pneumonia? Does this animal have that udder infection? So that way then I can start different treatment protocols to try to get her back on track, get her healthy again, but also get her producing appropriately again. So that's where kind of the veterinarian comes in on an individual animal basis. And then obviously we might see trends. So I might start noticing that, hey, the last 5 sick cows I've seen here have had this same disease process. So that can help me kind of take that individual animal and extrapolate it out to the farm in general and try to figure out, do we have an outbreak of a disease process happening on this farm that then I have to try to kind of solve the problem there.
Right.
So that's kind of it for, yeah. It's interesting kind of that change that goes back and forth in being a large animal vet. And it's what I like the most about being a production vet, from the individual animal care back to the group care, back to the individual animal care. We see that in adult cattle as well as in calf care and everything like that. And so it's all a very big system. And obviously you guys are hearing from all the different people that are involved in that system today. And so usually we all have to work as a team, consult with one another whenever we start seeing problems. You know, for example, if I started noticing that more and more cows were having that problem that I discussed over here, where they might twist their stomach and I have to do surgery, I'd go talk to my nutritionist, say, hey, it seems like I'm having a little bit more of this problem. That problem in particular can be directly related to a nutritional problem we'd want to work out. Is the nutrition proper here? Did we have something happen with how we're mixing the feed and it's not being mixed properly, or any problems like that? So it's really a group effort on the dairy between the veterinarian, the farmer, all of the other kind of different consultants on the farm to make sure that everything works appropriately and all the cows are happy and healthy.
Yeah, that's incredible. I mean, we all know our dairy farmers, of course, are superheroes, but as you just said, it is a team effort. You know, they need and rely on you guys to make sure everyone's happy and healthy. And obviously your work is incredibly important. We did have a question. They were asking, how often do the cows get these kind of healthcare checks? Like, is this like once a week, once a year, what is it? Or is it just when they're not looking well, or what's that look like?
So specifically from a veterinarian, it would be when they're not looking well. So that's usually the big time that a vet is going to get involved. Now, in general, this whole farm gets assessed every day by all of the people working here. So like I said, I set up protocols to try to train people on how to assess these animals. So as the pens are being cleaned, the guys are walking through, they're looking as the cows are moving. Is any cow lame? So are they limping and not feeling so well? They come out to get the cows up to go milk. Gosh, this cow didn't get up. Why is she not getting up? So while I might not be doing an exam every day on these animals, all of these animals get an overall evaluation by everyone that works on this farm as they're being handled and moved and kind of worked with throughout the day. Particularly, that's very important with the calf care. So I always say that the entire group of calves gets assessed on a medical level multiple times a day whenever they get fed. So whoever's coming out with the milk, I always tell them, you got to take that moment to stop and look at the calf. Does the calf seem bright, excited? Are they jumping up, coming to the milk or not? By doing that group exam, you can then create your list of individual animals that seemed off. And then the farmer would go ahead, they'd do their own little exam, figure out if it's something easy for them to assess and then treat, or do they need to get me involved? So from a veterinary perspective, I only see them when they're sick and they need me, other than just my weekly exam of the reproductive tracts and pregnancy diagnosis and such. But every animal on this farm is being assessed for their health and well-being every day by the farmer and all of the staff that's working here, as well as the advances in technology that we can use to kind of try to assess that from a data-driven set. So we already talked about like the milk production being monitored by the milking parlor and everything. There's plenty of other monitoring systems, whether it be rumination collars that will measure how often that portion of their stomach is churning over simply by how are they chewing, how is their head moving, things like that. So you can actually get a readout on the computer from every single cow on how they're doing and how they're digesting every day. And that can help farmers pick out, hey, that cow's not doing as well, without them even having to go look at the animal. You can have activity monitors on them, whether it be ear tags, collars, or anklets that gets put on them, that they can identify animals that they're not really being as active as they usually are. I should probably go take a peek at her and see if she's not feeling very well, or the opposite, and they're being overactive, which usually indicates they're what we would say in heat and ready to be bred. They typically have a big uptick in their activity because they're running around all crazy with their hormones flowing through. And so there's a lot of different methods that we can use to evaluate them. But just from a vet perspective, I'm only really looking at them when they're actually sick.
Sure. No, absolutely. I think that sounds awesome that they have their own like Fitbits. Like, well, how cool is that? That these guys, that, they can help. That can really help you and the farmers track their health. We did have another question. So obviously, we did this healthcare exam on a grown cow. And then you mentioned how, you have to kind of observe calves. Can you just maybe talk a little bit more about what does that observation look like for calf? Like, do you have to still do the pinging of the stomach with the calf, or like, are you just taking temperatures, or what does that look like?
So it's a little bit different when we do it on calves. Absolutely. They just aren't as developed and fully grown as these guys. And in fact, actually, their entire GI system is totally different. They still have those 4 compartments, but only one compartment's really working when they're little tiny calves. And so it is a little different. Whoever asked the question is actually right to bring up the pinging aspect. So I wouldn't ping them. So when I'm doing a physical exam on a calf, I'm taking their temperature, I'm listening to their heart and lungs, but then I'm doing more kind of physical with my hands evaluations. I'm going to go ahead and actually palpate their umbilical cord, the little remnant that's still there, make sure it doesn't feel thickened and infected. I always touch their joints a lot. I squeeze on them, make sure that it doesn't seem like they're stiff or there's any sort of kind of swelling or anything that can indicate some sort of an infection. And so it's just a little bit different. We don't do this massive big thing for them, but they get their own kind of specialized little exam. And so, yeah, you're just listening to that heart, listening to those lungs, feeling the umbilicus, checking on those joints, all of that. So they're not as in depth, and it is a little bit different than cows, but it's still a pretty involved examination whenever somebody does an exam on a calf.
Awesome. So another question. Now, you mentioned if they're not feeling well, then you have to treat them. What is something that you do when you have to treat a cow, and do you have to treat them for a long time? Is it like a 1-day process? What does the treatment process look like?
So it totally depends on whatever disease we are treating, what type of medicine that they need, right? Like if you have a cold or, pneumonia or anything, you need totally different meds than if you have diarrhea. And so it all depends on what type of treatments we have to use, what certain drugs we have to use. Even the antibiotics themselves could need to be given either for just 3 days or 4 days or 5 days or just one time. So it's completely different depending on what disease we're treating and what actual products we're using. Most commonly, obviously there's infection. We're going to be using antibiotics to try to fix that. We do take a lot of consideration into any sort of pain or discomfort in these animals. So we'll incorporate either non-steroidal medicine, so kind of like Advil, but for cows, or we'll use steroids if we need to, if the inflammation is that bad that we need something a little bit stronger than that non-steroidal. And then there's also some topical things that we can do for them. Obviously if she has a foot disease or something, I might need to wrap up her foot, put some kind of topical medication on there. It really just all depends on what disease we're treating in terms of what medicines we're going to get into to start using for them. My favorite thing is obviously if they have any sort of an upset stomach or anything, I always say to my vet students, what do you do whenever your stomach's upset, right? You take Pepto-Bismol, you take Imodium, something to kind of make you feel a little better. We do the same thing with them. So they actually get what I call a smoothie, where they get a lot of good probiotics and actually the cow version of Pepto-Bismol and some electrolytes just to kind of keep them hydrated and everything. And so we have to give them their nice little cow upset stomach smoothie whenever they start to have any diarrhea or anything like that.
Very cool. I love that.
Yeah.
Now, obviously, you are sharing a wealth of knowledge for us, and we are absolutely loving this. But I would love, and you talked a little bit about your background and your education. So obviously, you've been in school for a while. You've learned a lot of these incredible things. But if you don't mind kind of trying to share with us, what are some key skills that you need to be in a career of veterinary science?
What did you say? Okay. You're coming across just a little bit muffled. Could you repeat that last part just a little bit?
Yes. Can you hear me any better now or no?
Yeah, that's a little better.
Okay. We obviously have a lot of education. We were just wondering, what is a key skill that you need to be in a career in veterinary science?
Yeah, so obviously it takes a lot of passion and dedication. That's the biggest thing. I always tell people you don't become a veterinarian just because you love animals. Obviously, everybody loves animals. We all want animals to be so cute and happy and healthy and everything, but you have to be really dedicated to it. You have to love science. You have to always have this curiosity of wanting to learn more. Obviously I'm done my schooling, but medicine always changes. So even through my whole vet career, I'm going to be going to conferences and things like that. I always say the school's never really over. We're always still in school. But my biggest thing, like I said, an interest for science. You do have to know how to do some math, unfortunately, but definitely just kind of that overall curiosity and dedication to it. Schooling can get really hard and really complicated, and you kind of hit a point where you're like, man, do I really want to keep doing this? But if you find that drive and you find that passion to keep wanting to learn and keep going through it, that'll always help you kind of make those goals and everything. So it's not just loving animals. It's having that background in it. Obviously, if you're interested in going into this, try to find a way to work on a farm, try to find a way to shadow vets and everything. So you can really get the feel of what it is to actually work this job and work in this industry. Obviously it all looks, probably very nice and wonderful through the camera and everything. But when you're working it and you're out here and it's kind of chilly out here today, it gives you the real example of what it's like on a kind of full-time basis to get to have that in your life. And so just go get those opportunities and make sure that you really do love it and just find that passion for it. And that'll keep you going even in those hard times.
Awesome. Thank you so much, Emily. This has been wonderful. And just checking, can you hear me any better now?
Yes. Yeah.
Yes. Okay, perfect. No, this has been wonderful. I'm checking. I don't know that we have any more questions at this point, but is there anything before we kind of move on to the next spot? We've got a minute or two. Is there anything else you wanted to share with us just about your career, or what's your future goal, or what's your next steps, or anything like that you want to share before we move on?
Yeah. So, my path after vet school was a little different than most other veterinarians. I specifically wanted to work in what we would call academia. So working at a veterinary school following graduation. I love teaching and I love being involved with all of my students and everything. So I kind of wanted a career where I could be a vet, but also be involved with teaching and such. And not just teaching my students, but something like this, where we're getting out there to the public. We're working on kind of expanding knowledge about the industry and all different areas of that. And so while most people, once they graduate vet school, we're fully doctors when we graduate, they just move on to practicing. I actually went on to do those extra years, going to Ohio State, coming back to Penn for a little bit to become kind of that specialist status. That way I could go into it. So my goal is to stay kind of in academia and continue through that teaching for kind of the rest of my career and everything.
Awesome. We love that. And, while not everyone has a different path, we love that you're willing to be here for the education portion. And I'm learning so much just sitting here listening to you. So I'm sure you are exactly where you need to be for your career.
Thank you.
This has been incredible. Thank you so much for sharing all of this with us. This is really been
Absolutely. Great. Thank you guys for listening.